Hi everyone, this is Jim with JP Reacts, where we look at, react to, and analyze politician statements so you can have better conversations, both online and in person. Today we're going to go over the last presidential debate, which I know the election's coming up, so I think this information would definitely be helpful to those of you that still have to vote. Obviously the debate is an hour and a half long, so this video is not an hour and a half, so this will be in multiple parts. How many parts? I'm really not sure. But I think even if it happens where some of the parts come out after the election, it'd still be useful information to know what the politicians' plans are for the future. So we'll start right away, right into the debate, and we'll take a look at the first part of it right after this. Okay, so the first question of the debate was about the coronavirus and their plans to move forward, what each of their plans were to combat it moving forward. So let's listen to President Trump's response first.
2 minutes, uninterrupted.
So, as you know, 2.2 million people modeled out were expected to die. We closed up the greatest economy in the world in order to fight this horrible disease that came from China. It's a worldwide pandemic. It's all over the world. You see the spikes in Europe and many other places right now. If you notice, the mortality rate is down 85%. The excess mortality rate is way down and much lower than almost any other country. And we're fighting it, and we're fighting it hard. There is a spike. There was a spike in Florida, and it's now gone. There was a very big spike in Texas. It's now gone. There was a very big spike in Arizona. It's now gone. And there are some spikes and surges in other places. They will soon be gone. We have a vaccine that's coming. It's ready. It's going to be announced within weeks, and it's going to be delivered. We have Operation Warp Speed, which is the military is going to distribute the vaccine. I can tell you from personal experience that I was in the hospital. I had it, and I got better. And I will tell you that I had something that they gave me, a therapeutic, I guess they would call it. Some people could say it was a cure. But I was in for a short period of time, and I got better very fast, or I wouldn't be here tonight. And now they say I'm immune. Whether it's 4 months or a lifetime, nobody's been able to say that, but I'm immune. More and more people are getting better. We have a problem that's a worldwide problem. This is a worldwide problem. But I've been congratulated by the heads of many countries on what we've been able to do. If you take a look at what we've done in terms of goggles and masks and gowns and everything else, and in particular ventilators, we're now making ventilators all over the world, thousands and thousands a month, distributing them all over the world. It will go away, and as I say, we're rounding the turn, we're rounding the corner. It's going away.
Okay.
Okay, so President Trump really talked about the mortality rates and how well he did. Let's just get clear. He's talking about where we're at right now compared to where we've been. Basically, our mortality rate, which isn't the only thing that happens with coronavirus, has been around 2.5% to 3.5% this entire time. Right now, on the 28th of October, the United States is a little bit over 9 million coronavirus cases and a little bit over 233,000 deaths, which puts us a little bit over 2.5% mortality rate, which is basically where we've been most of the time. It's on the lower end now, which is good, but the numbers fluctuate every day, so it's hard to say if this is where we're going to stay or if it's going to go up or down. We don't really know. He also talked about vaccine being available in a couple weeks, which is unusual because from what I've heard from like the New England Medical Journal and other sources was that at best, first responders would have availability by the end of the year, maybe, and everybody else probably beginning or middle of next year, where we're going to have to socially distance probably through the end of next year. So hopefully we get some pushback on that, and we can find out a little bit more by what he means by that. But overall, he really talked about his past, what he's been doing. No real plan moving forward, so I'm a little bit concerned that he didn't answer the question, but hopefully as we move forward in this section, he talks a little bit more about what his plans will be moving forward. Next, let's listen to Vice President Biden's response to this question also.
220,000 Americans dead. If you hear nothing else I say tonight, hear this. Anyone who's responsible for not taking control, in fact, not saying I take no responsibility initially, anyone who's responsible for that many deaths should not remain as President of the United States of America. We're in a situation where there are 1,000 deaths a day now, 1,000 deaths a day, and there are over 70,000 new cases per day. Compared to what's going on in Europe, as the New England Medical Journal said, they're starting from a very low rate. We're starting from a very high rate. The expectation is we'll have another 200,000 Americans dead between now and the end of the year. If we just wore these masks, the President's own advisors have told him, we could save 100,000 lives. And we're in a circumstance where the President thus far and still has no plan, no comprehensive plan. What I would do is make sure we have everyone encouraged to wear a mask all the time. I would make sure we move in the direction of rapid testing, investing in rapid testing. I would make sure that we set up national standards as to how to open up schools and open up businesses so they can be safe and give them the wherewithal, the financial resources to be able to do that. We're in a situation now where the New England Medical Journal, one of the most serious journals in the whole world, said for the first time ever that the way this president has responded to this crisis has been absolutely tragic. And so, folks, I will take care of this. I will end this. I will make sure we have a plan.
Okay, so straight away, Vice President Biden was referring to the president not taking control of the situation. In other countries, primarily the national leader took a leadership role in running the response to the coronavirus, whereas President Trump really didn't. He really deferred it to the states, which led to a lot of different responses to different states depending on their individual thoughts on it. So some states did well, some states didn't do well, and it's really been a real hodgepodge, basically, of what's going on. But what he did mention, though, was that he would have an actual plan, and he did mention it. So he wanted to talk about encouraging mask use, which is not clear if he meant that he would mandate it. So hopefully he mentions that somehow in the future of this conversation. Rapid testing, which we kind of already have, but some of it isn't really good. So hopefully, I'm guessing he's talking about expanding it and hopefully improving the reliability. So that would be good. And then having an opening plan. So basically, a lot of communities have businesses, schools are closed. So he would have a concrete plan on what metrics these locations would need to meet to be able to open successfully. And he also talked about having resources set aside to help them get there. So hopefully that helps explain what he was talking about. Let's move on to the next part of this, where the moderator pushed back on President Trump's response about the vaccines, which I talked about earlier, which was confusing, his response to me. He did admit that he can't promise 2 weeks, which makes sense, because basically everything I've heard is what came out in the response, that first responders maybe by the end of the year, but everybody else beginning and middle of next year. He thinks he's right compared to the experts because he's relying on his knowledge in the military. Hopefully he's right and everybody can get vaccinated right away, but right now signs don't point in that direction. So Biden's follow-up to that was he was asked how he could help Americans feel comfortable with taking the vaccine, and he mentioned that he would have the process be more transparent so that people can trust the process and that it's safe and reliable. So that was his response to that. I'm not going to show that part of the video because it was a lot of back and forth, and that was the summary of it. So the next part I wanted to bring up was Trump, in this exchange, referred to his own experience with the coronavirus. As you know, earlier this month, he had contracted it and was in the hospital. So let's show his conversation about that.
I caught it I learned a lot. Great doctors, great hospitals, and now I recovered.
Okay, so the reason I wanted to show this part was President Trump's experience is not going to be the same as the average American. Presidents, rightfully so, have a lot more access to medicine than the average person. First of all, they have an in-house live-in doctor at the White House. And secondly, he went to Walter Reed, which is a public hospital with public doctors, government doctors, all that good stuff that work with active and vet military members. And he had doctors that sole purpose was to make sure he got better. And he had access to drugs, treatments that the average American still doesn't have access to because they haven't been fully tested, they haven't been proven safe. So those types of things wouldn't be available to the average American, especially Americans that do not have health insurance, which is a major issue right now in this country. So hopefully that's clear by that statement. Okay, so the next question was about, is the shutdowns worth it? Is the cost of the shutdown worth it? So let's listen to Vice President Biden's response to that first.
I'm going to shut down the virus, not the country. It's his ineptitude that caused the country to have to shut down in large part. Why businesses have gone under, why schools are closed, why so many people have lost their living, and why they're concerned. Those other concerns are real. That's why he should have been, instead of in a sand trap in his golf course, he should have been negotiating with Nancy Pelosi and the rest of the Democrats and Republicans about what to do about the acts they were passing for billions of dollars to make sure people had the capacity.
But you haven't ruled out more shutdowns.
Well, no, I'm not shutting down the nation, but there are, look, you need standards. The standard is if you have a reproduction rate in a community that's above a certain level, everybody says, slow up, more social distancing, do not open bars and do not open gymnasiums, do not open until you get this under control, under more control. But when you do open, give the people the capacity to be able to open and have the capacity to do it safely. For example, schools. Schools, they need a lot of money to open. They need to deal with ventilation systems. They need to deal with smaller classes, more teachers, more pods. And he's refused to support that money, or at least up to now.
Let's talk about.
So as you can see from his response, he's not ruling out more shutdowns, but he's going to do it based on metrics that the experts advise him on, which is a good idea. We want to make sure that we're moving in a way that makes sense and is going to actually eliminate the need for shutdowns eventually. But basically, he wanted to focus on making sure that the communities, states have the resources, money they need to make the improvements they need in these locations to make opening up actually effective and safe. Ventilation, he mentioned at one point, plexiglass, social distancing, all that good stuff that the resources were available. So that was his talk about shutdowns and making sure it made sense. Let's listen to President Trump's response to that same question.
If I might?
Please, and then I have a follow-up.
Thank you, and I appreciate that. Look, all he does is talk about shutdowns, but forget about him. His Democrat governors, Cuomo in New York, you look at what's going on in California, you look at Pennsylvania, North Carolina, Democrats all, they're shut down so tight and they're dying. They're dying. And he supports all these people. All he talks about is shutdowns. No, we're not going to shut down, and we have to open our schools. And it's like, as an example, I have a young son. He also tested positive. By the time I spoke to the doctor the second time, he was fine. It just went away. Young people, I guess it's their immune system.
Let me follow.
Okay, President Trump basically is promising no additional shutdowns. He wants the country to move forward and open up, which is good. He also talked a little bit about blue states dying. I'm not really sure what he was referring to in that case. It didn't make a lot of sense to me. I know that some blue states have higher amounts of death, but that's because there's more people in blue cities. So I'm not really sure what he's talking about there. Hopefully he clarifies it later on when he's talking as we move forward, or it's online somewhere and I can find it. But right now I have no idea really what he's talking about. Moving on to the next follow-up question in this series was talking about parents and them being afraid to send their kids to school. So let's listen to President Trump's response first.
In the schools, the transmittal rate to the teachers is very small, but I want to open the schools. We have to open our country. We're not going to have a country. You can't do this. We can't keep this country closed. This is a massive country with a massive economy. People are losing their jobs. They're committing suicide. There's depression, alcohol, drugs at a level that nobody's ever seen before. There's abuse, tremendous abuse. We have to open our country. You know, I've said it often. The cure cannot be worse than the problem itself. And that's what's happening. And he wants to close down. He'll close down the country if one person in our massive bureaucracy says we should close it down.
Vice President Biden.
Okay, so President Trump referred to the low mortality rate of children, which is actually true. But it's not just mortality that's a problem with the coronavirus. There are a lot of long-lasting effects that we don't even know all the effects yet and could have lifelong alterations to their quality of life. But the long and short of it is, although kids are in danger and are dying and getting these types of effects, the issue that we've been running into when it comes to schools is not necessarily the kids, but the teachers and the support staff, right? So kids might not actually be symptomatic, but they can pass the disease along to these people that work in the schools, teachers, support staff, who could be in a high-risk category. And being in a high-risk category myself, I know that could be scary. And if those people get sick, then who is going to teach the kids, right? So that's the long and short of what we're talking about with regards to kids. He then brought up the problems with shutdowns and the problems with people being stuck at home, which are all true. Domestic abuse, drug abuse, alcoholism, depression. Those are all problems, and I agree, and I'm glad he brought them up because they are problems and they need to be addressed. The only thing is he didn't really talk about what his plan was to address those things. Hopefully later on he says something about it, but other than just reopening, it doesn't seem like he has a real plan on how to address those things. Hopefully it's mentioned later on. Next, let's listen to Vice President Biden's response to this question.
Not true. We ought to be able to walk and chew gum at the same time. We ought to be able to safely open, but would they need resources to open? You need to be able to, for example, if you're going to open a business, have social distancing within the business. You need to have, if you have a restaurant, you need to have plexiglass dividers so people cannot infect one another. You need to be in a position where you can take testing rapidly and know whether a person is in fact infected. You need to be able to trace. You need to be able to provide all the resources that are needed to do this. And that is not inconsistent with saying that what we're going to make sure that we can open safely. And by the way, all you teachers out there, not that many of you are going to die, so don't worry about it. So don't worry about it. Come on.
So Vice President Biden's response was really focused on making sure the schools had the resources they need to be able to open effectively, to be able to be socially distanced, have plexiglass around so that it can reduce the spread. He again mentioned rapid tracing, which we talked about before. He also mentioned tracing. Now, tracing refers to contact tracing. Contact tracing basically means that if somebody gets tested and comes back positive for the coronavirus, that they go back over the last couple weeks to see who they came in contact with and test all of them to see if they got the disease. And then if any of them have it, they test their people. And basically the purpose of contact tracing is to contain the spread within the community. So if people quarantine until they know that they're free and do not have the coronavirus, to limit the spread of it. So that's what he was referring to. That basically, though, he's talking about providing more resources, more money to help schools be upgraded to be able to handle kids coming back to school, which is important. This last thing in this section was talking about President Trump's remarks earlier this week about the experts, and specifically Dr. Fauci, as being idiots or being a disaster. So let's listen to President Trump's response to that right now.
I'm listening to all of them, including Anthony. I get along very well with Anthony. But he did say, don't wear masks. He did say, as you know, this is not going to be a problem. I think he's a Democrat, but that's okay. He said, this is not going to be a problem. We are not going to have a problem at all. When Joe says that I said, Anthony Fauci said, and others, and many others, and I'm not knocking him a lot. Nobody knew. Look, nobody knew what this thing was. Nobody knew where it was coming from, what it was. We've learned a lot. But Anthony said, don't wear masks. Now he wants to wear masks. Anthony also said, if you look back, exact words, here's his exact words. This is no problem. This is going to go away soon. So he's allowed to make mistakes. He happens to be a good person.
Vice President Biden.
So President Trump talked a lot about it, and he was right that early on they said they shouldn't wear masks. That's going to happen, though, in defense of scientists. This is a brand new virus. We didn't know what was going on. And as we gain more information, they update the recommendations. Early on, did they say no masks? Yeah, they said no masks. Was that the right answer? Looking back from where we are now, no, that was definitely not the right answer. But we also have to remember back then, there was also a major concern of a shortage of masks, that first responders would not have the masks they need because we didn't really have a good stockpile yet. So that's one of the reasons why no mask was provided, but also they didn't have all the information. Now we have more information, so in defense of scientists, as they have changed the recommendations, as they've gained more information. So let's see what Vice President Biden's response to this was.
The response is that think about what the president knew in January and didn't tell the American people. He was told this was a serious virus that spread in the air, and it was much worse than the flu. He went on record and said to one of your colleagues, recorded, that in fact he knew how dangerous it was, but he didn't want to tell us. He didn't want to tell us because he didn't want us to panic. He didn't want us, Americans don't panic. He panicked. But guess what? In the meantime, we found out in the New York Times the other day that in fact his folks went to Wall Street and said this is a really dangerous thing, and a memo out of that meeting, not from his administration, but from some of the brokers, said sell short because we got to get moving. It's a dangerous problem.
Okay, so Vice President Biden didn't really respond to the comment because he didn't make it, so he didn't really feel the need to respond to it. But basically, he did talk about what President Trump knew and when he knew it about the virus, it being dangerous, it being airborne, and being a problem. There is some recent reporting and some audio that's available online of President Trump talking to a reporter, I think it's Bob Woodward, about the virus back in either late January or early February, and about how dangerous it was. So Trump's comments back those are public record. You could see his downplaying of the virus publicly, but in his response to the reporter, he was more talking about the dangers. So that's what Vice President Biden was referring to. Okay, so that's going to wrap up this video for the debate. Obviously, we're only about 35 minutes in, and there's a lot more debate to go. So hopefully you learned something and helps you have better conversations, both online and in person, about this topic. If you felt like it was helpful, please like it. If you felt like I didn't really provide good value, you could dislike it. But either way, please subscribe to the channel. I really appreciate it, and that way you can see when the next version of this pops up. I'm going to look forward to seeing your comments below and taking that into account as I move forward on this series. So until I see you again, have a great day, everybody.